terms elderly, invasive, and the phrase patients are evaluated are often used in healthcare research and sometimes in the NHS. However, do people really understand when these terms should and shouldn't be used? We asked people, including those with a scientific or healthcare background, what they think a healthcare professional means when they use these words. Many people gave multiple answers. Only 2% said they didn't know what the word elderly meant. The majority of people linked the word elderly to appearance or frailty, while others referred to it being linked to the age of retirement. However, some people link the word to a specific age, but the ages given ranged from over 55 to over 80. The most common starting ages were over 70 and over 65. A small number of people said it related to being over a certain age, but didn't specify the age. 2% of respondents just said that it was older than them. When we asked people at what age they personally think people become elderly, a wider range of ages were given, from over 50 years old to 90. Some people felt that it depended on the person, or said that their perception of what age elderly started had changed over time. Importantly, it was also seen as an offensive term by some people. Regarding the word invasive, only 1% of respondents said they didn't know what this meant in the context of healthcare. The majority of people felt the term invasive was linked to something entering or happening inside the body. However, the nature of this differed. 13% of people only mentioned surgery, operating or cutting the skin. 11% of people said it meant either entering the body through surgery, cutting the skin, or via an orifice. Others just gave a general statement about something entering or happening inside the body, sometimes giving specific examples. However, many people saw it as something negative, using words such as aggressive, attacks, or harmful. Other respondents described it as something that's disruptive, serious, painful, or complex. A small group simply saw it as something moving outside of its usual location, a procedure that is personal or embarrassing, or an illness that is passed on easily. When we asked everyone which of the following tests were invasive, most people said a biopsy or endoscopy. Over half said a blood test, and 26% said an oral examination. Only 1% felt a urine test was invasive. Regarding the phrase, patients are evaluated, 8% of people said they didn't know what was meant by this. The majority of people understood the phrase to mean assessed, or reviewed, tested, examined, or questioned. Other people talked about specific purposes for the activity, such as diagnosing or assessing illness. To decide on treatments, monitor treatments, or assessment for triage. Others thought it meant to determine eligibility for clinical trials, assessment of capacity, or fitness. Having a scientific or healthcare background made no difference to the range of meanings given for the phrase. Even when the phrase was put into the context of a sentence, people's understanding of it still varied. When we replaced the word evaluated in a sentence, 69% felt that the sentence was clearer. However, some people felt that the word evaluated was inappropriate because it could be seen as a value judgment, whilst others had the same concern about the word assessed. This study demonstrates the need for all of these words to be considered carefully, and in some situations to be avoided completely, substituted by less offensive and less frightening alternatives.